sorry, we'll start again. So I'm Michelle Angell from Mid and South Essex Integrated Health and Care Partnership, and I'm with Dr. Jose Garcia, who's our Southend CCG Clinical Commissioning Chair, but also a GP for Pall Mall surgery. So in terms of the benefits, as you've heard from the previous presentations, there's significant research to evidence that this form of support and gardening and social prescribing is there to reduce anxiety, supports low mood, enables to improve health and well-being for the population that we serve. It enables you to grow in terms of community support mechanisms, and has a significant impact upon the wider health system and social care system. So in terms of children and young people, so the young chap in the slide there is my son Jacob, who during COVID-19 became increasingly anxious about going outside. So he has asthma, and so being socially active and getting out and running around is really important. So remembering the sort of passionate presentations that Jose and Samble, one of our mental health leads, previously mentioned around the benefits of gardening on your mental health and well-being, we made sure that we created a little gardening plot in our own garden. We were lucky enough to have that, and I know that that is one of the things that TrustLinks and other charities are able to support those that don't. And we saw that almost instantaneously the mood improved. He still continues to enjoy his little herb patch and his vegetable garden, and the delight in growing his own potatoes was significant. So for children, it gives them the sort of self of well-being and purpose, and they can see the instant benefits. They can physically be outside, enjoying the outside, and reducing any signs of stress and depression and anxiety. But also connects you to the wider sort of community and family mechanisms. In respect of our partnership working, so we had a number of sites in the sort of southeast Essex area, so Shoeburyness, Watford and Fundersley, and we started to see the benefits from those sites on the wider health system and social care system. Working together to sort of start to build on that approach further across Mid and South Essex, we've agreed to fund additional revenue funding for 3 years for a site on Bange, which is Basildon Way, Canvey Island and Crescent Temple. So working together with TrustLinks and local authorities across the system, linking up to other voluntary sector services, to really start to work together on a holistic approach for mental health and well-being, but also the physical health that, you know, activities such as gardening benefit, and linking to initiatives such as Active Essex and other areas. So we've got the sort of green gardening elements from the Basildon District Council's areas as well. So it's really about building on the model, working together to get the best out of it for our population. I think one of the things we've seen as well is this is transferring into the wider healthcare system. So we're starting to look at things like respiratory services, where we're looking at breathlessness, and not in terms of just treating an individual, but also about their physical health and also their mental health, to manage anxiety and reduce that to support with their breathlessness and their ongoing therapy needs. In terms of benefits to the NHS specifically, it's already been mentioned, but it can reduce GP appointments. There's a number of patients that will attend primary care practice for support around low mood, mental health, PTSD, other aspects, anxiety and depression, but also loneliness. There's quite a lot of people that will connect with primary care services because of just feeling lonely. Reduction in A&E attendances, and obviously patients that are in crises, so this sort of initiative can support reduce those numbers, and obviously demand for mental health services. You can see a reduction in falls, so the more physically active we keep people, especially elderly residents, we can then improve their balance and reduce the number of falls. And we're seeing this in other areas as well, where we're sort of involving greater activities across the system. There's obviously then an impact on prescribing costs, so reduction in antidepressants, and that reduction in exacerbation of long-term conditions. You can support people to reduce weight, but also things like respiratory conditions, asthma, they're all improved by moving and getting out into the fresh air and taking part in these activities. And again, diabetes and CVD, which is coronary vascular disease, so blood pressure can be reduced through physical activity. Jose will come on to a case study, but was a reduction in suicide rates, potentially, from obviously improving mental health and well-being, and improve outcomes for dementia patients and their next of kin. There's also, we have an all-age long-COVID service within Mid and South Essex, and this is something that's currently referring to IAPS, but could also link into these services to support those patients that have experienced fatigue and sort of, mental health and anxiety through having COVID. So we're now working with trust links as well. So one of the things that's come up through the conversations previously is how do we capture this excellent work and demonstrate going forwards the impact it's having on health and care. And I think for us, linking it to our System 1, so System 1 is a GP or healthcare shared data system, and our community providers, our primary care providers and our mental health providers all utilise System 1. And we're now working with Trust Links and other voluntary sector charities to share this information so that we can start to capture some of this data and activity and be able to look at the cohorts of patients that are accessing these services, but also make sure that the care is personalised. This brings us on to Jose's story.
Thank you, Michelle. So Matt has said to me, Jose, do you have your pack? And I say, sorry, I don't have a pack. I don't have a presentation. But what can I share with you is a couple of cases, and as a clinician, what for me is the benefit of something like this. And the first case, Matt may remember, because he made a mistake of inviting me to the annual general meeting, and I brought this case because it's a case that always will go with me. A patient who had a tragedy in the family. The son committed suicide. So we don't have to we know that the tragedy and the impact. So I was following him and supporting him, his wife, and at some point the couple were growing apart, and he started on medication, but an antidepressant didn't do what it was supposed to do. Things were not really going well, and he tried. He was a fighter. He was fighting. He was really open. He was seeking help. So we discussed that the possibility of going to Trust Links, and I don't have to tell you the benefit of that. And I summarize with a sentence that he said to me when, after a while, we had the conversation, and when I asked him about, for me, going to the annual general meeting and say, do you mind if I share your case? And I said, no, please tell everybody how good it has made to me. And I said, what do you want for me to tell? I said to me, tell them that it's heaven. And for me, it was enough to bring there, and it was a summary of how was impacting on him, and the benefit that it brought to him and the rest of the family. And the other case is, it really taps into something more recent. It taps into into what we have been discussing before at the break rooms. It was about those kind of barriers, what kind of, how we need to work with people about that. And it was a relatively young person with a lot of anxiety. She was struggling to going out, and again she tried therapy, did help somehow, but not to the point that she was that confident. Medication again wasn't the best. So we started to have that conversation, but you know what, gardening wasn't for her, and meeting people wasn't for her. Fine. So what you do, yes, you have to create the time, you have to create the space. So we carry on with the conversation, and that concept of is not just gardening, is much more than that. Is learning, is being out, is choosing your pace, is people understanding when you are, is not judgmental, is for you as an individual. There's no labels, there is no, there's is you and your needs, and that offer from us in the surgery to support that journey, and knowing that an organization like that will be there to support. A step after step, and after several conversations, he was willing to try. And again, it was really hard at the beginning, but definitely was working for her. And okay, she's not going to be on the BBC perhaps of gardening programs, but definitely has developed an interest on gardening, and clearly has helped that anxiety going out, meeting with people. So for me, listening all the benefits that the NHS that brought for the NHS is, for me as a clinician, I'm also a health coach. So for me, what things like that they bring, and especially for my experience with TransLinks, TransLinks is not paying me anything for that, but I have experience firsthand with my patients how it works. So it clearly helps us to create a less medicalized model. It helps us to empower people. It helps to reduce health inequalities, and definitely is a much better experience as a person with a need. To when the conversation is not about the next appointment, or increasing that dose, or perhaps perhaps try different drug or possible side effects. When you're talking about something that really empower you as a person with your strengths and your weaknesses, and there are people there to support you in that way, with that seamless transition between being in a medical building to be in less than a mile in a setting, in my case, in a setting where you're out in a space that even is the traffic, but sometimes could be busy, is particularly quiet for the location. So that conversation, it gives me a much more satisfying work experience as a clinician, and definitely clearly fits in within what we want as an ICS. We want to empower, we want to prevention, we want reducing inequality. So for me, the question is why the NHS want to invest. I say, why not? It makes sense to invest in something like that. Who wouldn't do that? It will be my answer to that. Thank you.
Thank you so much, Jose. That's really fantastic. And thank you, Michelle, for your presentation.